Hey y'all, we are live for Whiskey, Wine, and Spine. So here we go. All right, Vic, you ready? All right, we're just waiting for Vic to get his camera settled, and we're gonna start talking about the aging process. So that's our topic for today, is aging. And I know a lot of our audience is not so concerned about aging because they're mostly in their 20s and 30s. But we're here to talk about why you should be concerned about aging. And for anyone who's parents, definitely this is also for you too. So listen up.
Word.
Yeah, and as you guys know, I'm Dr. Kelsey, and this is Dr. Vickers. And yeah, cheers.
Salute.
So this week should probably be more like whiskey, gin, and spine, because I have a gin slushy from
She's cheating, but it's still kind of her birthday, so she can do what she wants, I guess.
Yeah, birthday month.
But here's to y'all who have your wine glasses. It is Saturday, so here's to brunch. I'm currently rocking the old fashioned. Yeah. So those of you who don't know, big into functional fitness or performance. As far as that goes, I'm a rehabilitation specialist, muscle work specialist, and yeah.
Yeah, and I do a lot of pelvic floor therapy, pelvic floor work. I work with a lot of pregnant moms and postnatal women, and on their fitness and nutrition as well. So, yeah, we both are just excited to talk about this process. And, you know, when Vic talks about aging, he kind of brings a functional perspective, which is pretty cool. And then when I talk about aging, you know, I kind of dug way back into the research for the people that saw my post yesterday in, you know, looking at spinal development from a very early stage. So really wanting to bring that relevance, that importance to the moms that are part of my audience.
Mm-hmm.
Cool.
So where did we get this topic, Kelsey?
So after our first episode that we did of this podcast, my dad had reached out to me. And for those of you who don't know my dad that are watching, my dad is a total gym rat. He just loves lifting, and he's the one that actually got me involved in lifting and throwing shot put in high school. So he, you know, asked me, he was like, "Hey, can I be a guest?" And we were like, let's pump the brakes here, Tony. And I was like, "Well, what do you want to talk about?" And he was like, "Well, I want to talk about old people." And I was like, "Okay, we'll talk about old people." And so when Vic and I talked about it, and actually the week after, his Uncle Monty reached out to us and asked us the same thing. He was like, "Hey, can you guys talk about old people on your podcast?" So when Vic and I talked about it, we talked about the different, you know, when we're talking about aging, we see so many people come into the clinic or come to us with pain, and they say, "Well, it's just old age." And
that happens a lot. That happened to me. That happened to me. I counted yesterday. It was 2 days ago. Between Thursday and Friday, I had people tell me that 13 times.
Yeah, and I, you know, for me, and I know Vic is kind of similar, but for me personally, when someone comes to me and says, "Oh, this is just old age," it really pisses me off, because yes and no, right? And when we talk about it, we talk about, you know, we have to break it down to what is the source of the pain. So is the source of the pain something that is muscular, or is it something that's a bony change and a bone related issue?
Is it malleable or is it not? Is it structural or is it not? And to put that in perspective, cartilage has a really, really, really tough time growing back, unless you want to talk about stem cell, which is a totally different situation. But there are ways to, bones will change, muscles will change, and joints will change depending on your age. We'll talk about that in a second, what we mean by age. We're trying to kind of redefine the ways that people think about that. And then, you know, the structural changes, what you can do about them. So to dive into it, Tony, shout out Tony. I don't know if you're watching right now, but I'm sure you will. He's kind of a gym rat. He's been doing this for a very long time. He's very experienced in it. I've seen him work out before. He's very good at it. You know, he's been doing it for a while. So the main thing comes to fitness and aging. As you age, how fitness changes, kind of what that means. Whenever we talk about people coming in and says it's just my age, usually they're talking about like, you know, if they have knee pain, and I'm working on their neck, and I'll be like, is anything else like bothering you? And they talk, well, my knees hurt, but that's just old age.
Mm-hmm.
Maybe not.
Well, I think too, when a patient comes to us, they don't know the source of their pain.
They
right?
just
Like
accepted it.
they've just accepted that pain is normal, and that
So
pain
many-
is a normal process of age. And we're here to kind of say, like, that's not necessarily true, right? Like it could be true. It could be that age is a factor, but
It's definitely not the only factor.
But it's not the only factor, and more likely than not, it's that you've had shitty movement patterns for years.
Yeah, and what we mean by that is that the person who sits on the couch and is sedentary, that looks the same externally and weighs the same, has the same diet, everything else. The person who works out versus the person who is sedentary, their muscles will look different, their joints will look different, and their bones will look different. Whenever we're talking about aging, we're talking about time under tension and what you're doing in that time, what kind of tension you're doing.
Mm-hmm.
So we'll kind of dive into it. I think y'all understand kind of the basis of what we're talking about.
Yeah. So, if you're 50, say, and you're now starting to get pain, well, the difference between when you're 50 and when you were 30 is the fact that when you were 30, you were having that bad movement pattern for, say, 20 years, right? Because it probably started when you were really young, which is what we're going to get into as well, and just development and how that affects your aging process and your mechanics. But it probably started when you were really young. So at age, 30, you had only been doing that pattern for 20 years, and it maybe didn't become painful. And then as the years went on, then at 50, you've then been doing it for 40 years. And that's the point that it became painful. So the only real exception to that we found as part of the aging process is an arthritic situation. So unless it's arthritis and it's actually a structural change within the joint, then most pain is mechanical, and it's due to muscular patterns. So if that's something that's the source of your pain, then that's something that you could be preventing from early on. So for most of our audience, the people that are our age that are watching this and that are tuning in, you need to be worried about aging now. Is that scary you? What else is scary?
The point of this isn't we're not whenever we say like y'all should be thinking about it now. Yeah, what we mean by that is like you got to find out again your goals. We talk about this almost every podcast. You need to have goals whenever it comes down to it. Let's say you want to squat 700 pounds. That's dope. I respect that a lot, but you should probably think about what's going to happen in the future. How long is it going to take you to get there? Unless you're on steroids, which will destroy your joints, which is a totally different scenario. But it'll probably take you a while, especially 700 pounds. I don't care how much steroids you're doing. That's a ton of weight. It's probably going to take you years and years and years. And what I mean by that is you should probably think about it now because you can, based on age and time under tension, the only thing that's going to change the physiology of bones, joints, and muscles is load. So, person on the couch, not moving, not that much load. Person 100 pounds, a ton of load. So it's going to change the joint to an extent. So you need to plan based on that. You need to plan when we say like I don't want you to be scared necessarily, but you need to start planning now. You don't need to throw a football 50 yards if you're not in high school anymore. High school quarterbacks that were in varsity and were supposed to go to the NFL. Stuff like that. You need to start like thinking about, well, what do I do every day? I hold a baby. Maybe we should talk about a functional pattern that we should work on. I'm getting a little passionate about stuff, but the point is that we don't want to scare you in it. I don't want 5, 10, and 20 years. And how you protect yourself. Yeah. You are malleable when you're young. You're not as malleable when you're older.
And what I really like, so in the middle of the week when Vic and I were talking this out, he had sent me a Snapchat of something in his textbook right here that he got a lot of really great information from. And also a shout out to Teeter, because you were on the phone with Tom Teeter for a while about this subject. And we're definitely going to be bringing him on the podcast once we get
for sure. Tom Teeter, for those of you who don't know, is one of my mentors and someone that is a god in the rehab and fitness industry.
So
we're bringing
really
him on
excited.
as a guest. So talk to him a long time about. stuff like this.
Yeah, but one thing I really like that Vic had sent me as part of his book, as part of the book of what he was reading, is that, load is the only thing that makes a change in your body, right? So if you're loading your body, and we can use just the squat as an example, right? If you go from doing 0 to a body weight squat, that's a load, right? If you go from a body weight squat to putting a 10-pound dumbbell in your hands, that's a load, that's a change, right? So that's how you produce change in your body. Now, there's a threshold for how much load you need to produce a change, and then putting you at risk for injury.
Yep.
But without exposing yourself to that risk, you have no chance of progression.
Yeah.
Right. So it's a fine line between creating that.
To put it simply, injury and adaptation are both the result of stress.
Mm-hmm.
No stress, no progress.
Mm-hmm.
No stress, no injury.
Mm-hmm.
To put that in a very basic way, if you go lay down on a couch for the rest of your life, are you going to get injured? No, probably not. You're going to die sooner? Probably. Yeah.
Mm-hmm.
To the person doing like steroids and a whole bunch of stuff, that's creating just a ton of load.
Mm-hmm.
Are you going to die sooner? It depends on your system. Maybe take out steroids. But the person who is obsessed with doing a PR or something along those lines that are loading excessively, maybe too quickly, maybe too much, maybe both, or longer durations, you name it. May or may not live longer. You're going to get injured. Yeah, it's gonna happen.
I mean, if you're lifting heavy and you're actually pushing yourself, it's inevitable.
It's gonna happen
at some point, right? And I think another thing we're seeing right now, a lot with people in quarantine and working out at home, is that they're really struggling to meet that threshold, right? They're really struggling to say like, hey, I need to push myself. So they're getting in these really repetitive patterns, which are then creating injury, and they're really struggling to push themselves. So I think that's a big issue right now too, with just everything going on in the world and everyone.
Yeah, I talked about this. Yeah, I talked about this last time. I know people that can squat 700 pounds. Mm-hmm. It's really impressive, but they can't lunge. Mm-hmm. They can't stand on one leg for more than 10, 20 seconds. And balance and stuff. Functionally speaking, y'all, that doesn't make sense. You're gonna have back problems. You're gonna have knee problems. You're gonna have the issues like that. So old age isn't necessarily, I don't want y'all to think it is normal, but at the same time, I don't want y'all to straight up just accept it. Mm-hmm. I had a patient come in the other day, and she had bilateral knee pain, both knees, bilateral, both sides, knee pain, and it was constant. And I found out what she did for like the last 10 years, and she just sits down and works the whole time. Then she goes home and sits down on the couch and watches TV, and she just doesn't move a lot. Mm-hmm. Kid you not. I put this using. She was mad. I don't really care though. So I got her on a stroller chair. Like if you ever go to a doctor's office, there's a little chair that rolls around for obvious reasons. I got her on that and went into the rehab room, and I had her, if she's sitting here, just pull herself forward with her hamstrings, kind of bending, kind of walking like that while she's sitting for 10 yards. And then she came back and pushed herself backwards. She did that 3 times. She got back up and said her knees felt better. Mm-hmm. Why? So we're going to dive into that a little bit, but the main thing I need y'all to understand, again, load will change the physiology of the bones, joints, and muscles, for one. 2, I said this last time, I keep saying it so people will understand this, but go watch our other podcasts. Joints, cartilage, there's a bunch of different types of joints, whether you're talking synovial or cartilaginous or whatever. Mm-hmm. They don't have a lot of blood flow, if any, so they get it through movement, meaning it's a sponge. If anyone gets a sponge and puts it underwater, it will receive water, but I don't know a single person that does this. They get a sponge and they go like this. You have to move to create space that needs to be filled.
Gotta warm that sucker up.
Oh God, there's the accent. It's going to happen every podcast. I've accepted it.
Yeah. So, the take home, I guess, of the aging process is that if you're blaming your pain on age only, and you go into an office and you say, my knees hurt, but don't bother looking at it because it's old age, you're ripping yourself off of healing. And you need to stop putting age as a crutch or as an excuse, because you're going to have breakdown.
It is a
the older
factor.
you get. It is a factor, but that factor is just time.
That's
the factor.
That's like you coming to me and saying like, oh, I'm super weak, but it's just old age. How many 60, 70, 80-year-olds do you know that go into a gym and they get stronger as they put a weight in their hand?
Mm-hmm.
It's the same thing, y'all. Just because there's pain pain is, first of all, y'all need to understand there are no pain receptors. I don't care who you're talking to. There are no pain receptors, because for there to be a pain receptor, there needs to be something that you can measure, hold, and transfer. Pain is made up in the brain to tell the brain that there's a tissue damage or potential tissue damage.
Mm-hmm.
Pain is not real. It's great. I'm not saying like, push through it, y'all. Light your hands on fire because pain's not real. Don't do that. But I'm not saying all that. But the point of that is there's a reason why there's pain.
Mm-hmm.
You should probably do something about it.
Yeah.
If your hand is on fire,
mm-hmm. you
should probably do something about it. If your knees hurt, you should probably do something about it. If your back hurts, you should probably do something about it. Yeah. So you have to load
mm-hmm.
in order to create change. Is it going to be quick? Probably not. But
mm-hmm.
just to give y'all, just to help y'all out, I don't want y'all to straight up just accept that you've turned 50 this year
mm-hmm.
and pain is inevitable, because that's what age is. That's not necessarily the case. It depends on what you were doing the last 49 years.
Mm-hmm. And I know we do have a couple questions that have been popping up, and we'll look at those at the end, because we're a little far away to be able to see. So if you guys have questions, keep them coming. We are going to look at them and address them.
Yeah, I know. There are nociceptors. I'm not saying that, but pain is not a chemical or anything. So I'm not saying that pain is fake or anything like that. But yes, I would agree that there are nociceptors.
So I guess off of that too, since we're in agreement, and hopefully everyone watching is in agreement, that pain related to old age is really a result of two different factors: time under tension and poor biomechanics. Mm-hmm. Right? So let's dive into a little bit the poor biomechanics, because when I posted yesterday a little bit about bone density and tying that into our discussion, because I actually had no idea before we started researching this topic, but for women, your bone density is 95% formed by age 20, and for men, 95% formed by the age of 28. And so I went back in my head and I was like, well, what was I doing at age 20 and before that? I was obsessively doing cardio to make myself as thin as possible. I was eating Fruit Loops for dinner, dancing on a frat table, and drinking Franzia out of a box. I was not doing things to create a solid bone density mm-hmm. pattern in my body. And I mean, I don't know a single woman that before the age of 20 was I'm super confident and I'm going to do all these things to produce bone density. But no one is thinking about that before the age of 20. So, this really starts with parents and with the parents of our future, really instilling these habits when you are young. And that's also from even, if you want to even dig back even further into fetal development and what happens when you're born and developing the curves of the spine when you are born, that is, crucial to biomechanics. So do you want to dive into a little bit about that? Because I know I could talk forever about it, but.
As far as
lordotic curve forming.
Oh, well, yeah. I mean, you can dive in more to that on your side, but for people to understand, I've had a few people ask me whenever they're infants, they feel like they have a hunchback,
mm-hmm.
they kind of think that. To put people at ease, there are two different curves in the spine. And if you ever look at a spine, it doesn't do this. It goes like this. It's shock absorption. But there's a lordotic curve that's in your neck and your low back. And then there's a kyphotic curve, which is in your thoracic mid-back, kind of humpback and Notre Dame, depending on who you're talking to. I know that's scoliosis for anyone who's going to ask me questions or pinpoint something. But that's how you kind of think of that. The sacrum, whenever you're born, it's just straight up kyphotic. It's just a long, it's this the
so
whole
when,
time. So
when babies are in their bellies, they're like this, right? And then it's not until you start introducing things like tummy time that babies start to lift their heads and they develop a curve in their spine, right? And then not until they start to crawl and their lower back kind of sags that they get the lordotic curve, right? So if you're not setting up your kiddos for those movement patterns from a really young age, then that time under tension and those crappy movement patterns are more likely to brew into, as time goes on, as they age, a painful, dysfunctional pattern. So if you're a parent right now, which I know a lot of our audience is our age and has kiddos, that's you really need to be worried about aging. And we talked about kind of redefining the term aging, but you really need to be worried about that from day one. That's when you need to be worrying about it.
Yeah, for sure. For those of you who are watching, who know like FMS, SFMA, stuff like that, like FMS, I don't know if you've ever noticed, but it's pretty basic as far as like what does a baby do? Babies crawl, babies step, babies squat, babies stand up, stuff like that. I don't know how many of y'all have tried crawling recently. Probably harder than you think because we haven't done it in a while. But basic movement patterns are there for a reason. People that give their kids tablets and before anyone shoots me, no, I don't have a kid. Yes, I understand that it's difficult. I don't know if you have 3 kids, 6 kids, 1 kid, I don't care. But if you put a tablet or something in front of your kid's face and they start having neck pain by the age of 15, that is not their fault.
Oh, we had a kiddo it was about a year ago in practice, and his neck pain was so severe, I sent him for x-rays because he was 9. And I was like, 9 years old, like you shouldn't be having severe neck pain. Like that's not okay.
Right.
And so we sent him for an x-ray and the lordotic curve in his neck. So your neck is supposed to curve up like this, right? Like that's that banana.
Going like this.
Okay, that banana curve. This kid, when you looked at his x-rays, and I'm not the kind of chiropractor that wants to x-ray every patient. I'm not like that. I don't think it's necessary. I don't like to run unnecessary tests. But this kiddo's pain was so severe. I was like, man, I'm not touching you until we take a look at this spine. And his neck, the curve had actually reversed. So instead of it being this way, it was this way. And he was 9.
That's incredible.
That's terrifying. And
that's really hard to do.
Again,
that is not normal.
And again, we don't have kids. So for us, I don't judge parents that put, tablets in front of their kids. I don't judge them for that. But at the same time, seeing that type of a curve. And I also know that schools now are a lot more intense and competitive than they were when we were going through them.
Oh my God.
And not to say that it was the parents' fault, right? This kiddo could have been doing hours of homework and been in bookworm.
True.
And,
yeah, for sure.
That's not his fault either. But
something to consider whenever you have a young kid. Probably make them do some exercises to combat that, which is literally what we're talking about. But yeah.
But at that age when they're so young, their bones are so malleable. Like when you're looking at adults' X-rays, you can see like it's very distinct. You've got like bone, disc, right, and everything is very uniform. But in the X-rays of a child, the bones kind of look like they're floating because the tissues just aren't fully formed yet.
It's cartilage.
Yeah, it's all cartilage. It's like rubber. So at that young age, when they're doing this all the time, it progresses that curve in the wrong direction much more quickly than an adult.
Yeah.
So
to put that in perspective, you're supposed to be looking up, lordotic, this, and if you're looking down, you're literally making that curve the opposite, so it adapts. And then you start having neurological issues because that's based on how the vertebrae are created. It doesn't fit well with the vertebrae. Is it a huge deal? Probably not. At the age of 9? Yeah. Probably something, I'm not really worried about the curve as much as I'm worried about what's to come later.
Yeah.
So that's kind of where it's at as far as like aging goes, as far as, again, we are kind of diving into old age and fitness and stuff like that. But to give y'all, we're starting to notice that younger people are going to say it's because of my old age much, much, much sooner than my dad, her dad, and situations like that because of what we're seeing, because of how we're loading the spine. This is loading the spine. That's how you load the spine, by changing it and doing something else. There's gravity. Gravity is going to be a load. So whenever it comes down to functionally speaking, if there are injuries, we're talking about overtraining. There's kind of two different types of overtraining. Really comes down to you're underprepared or you're overstimulated. Have you warmed up? That was last podcast, which I hate the term warm up, pre-activity preparation for my guys, for my women, my people that watched our podcast and understood it. I feel like a lot of people are asking or telling me whenever they talk about pain in the knees and the joints and stuff like that, it's just my old age. As doctors, what we're probably seeing is that you're thinking that it's arthritis. Most likely, just because of age. You're not wrong, but you're also not right.
I see that a lot. A lot of people come in and they just assume something is an arthritic change or an arthritis issue, and they've just accepted it. And you know, I take a deep breath when I hear that. And I have to calm down because it drives me crazy. Because even if, regardless of whether the pain is due to an arthritic change or not, something that's due to arthritis is actually due to time under tension and age and the wearing down of that cartilage in the joint. But at the same time, movement is still the answer, right? And then same thing, if the source of the pain is muscular, then it's not in fact due to your age, it's due to your crappy movement patterns from going on for years. But movement is still the answer, right? So regardless of the source of your pain or your age, movement is still the answer. And that's kind of the take home of what we, I think, want people to get out of this podcast this episode is that for the parents out there and the people that are our age, you need to be worried about aging now. You need to be worried about aging now. If you have kids, you need to be worried about their development, which is aging, right? It's not what we maybe traditionally think of as aging, but you need to worry about that now.
You need to be worrying about what you're doing every day. Not necessarily, and she's right about the aging, but you need to worry about your movement patterns that you're doing now or what you have been doing. Maybe don't look down as much. Maybe go do squats, something like that. What if I told you that your knee pain was due to muscles? Would y'all believe me? Make a fist. Make another fist. Here's the knee. That's a joint. Bone. Here's the quad. The quad doesn't go to here. The quad goes over the joint. Boop, like that. Hamstrings on the back come over the joint. They don't attach here. They go past the joint. What if I told you that you need to do foam rolling to not do this so much and to let it open up a little bit because the muscles are tight, which we'll talk about that, tight or whatever. Whether there's knots or issues, when it comes down to the actual muscle that's creating the dysfunction in your joint. This has nothing to do with old age unless you've been doing this for a very long time. So that's what y'all need to understand. If you foam roll, if you make the joints, the body, the muscles more malleable, it will change the pain. Referral patterns of certain muscles, if you go down the quad, the vastus medialis, which will be kind of the inside of the quad. Inner thigh. I can't tell you how many times that I've found a knot and I've gotten rid of it, and then their knee pain that's inside of their knee that they think is a meniscus is gone. Whether or not it's meniscus, I haven't done any MRIs because I don't think it's necessary, because if I can do muscle work and it goes away, why would it be meniscus? So those are things that I need y'all to understand. Like time under tension, yes, age is one thing for sure, but like y'all also need to understand it may not be your joints. It may be the muscles, which are incredibly valuable. Load them, work on them. It'll help your joints. What moves bones? Muscles. What do joints do? They help lubricate in between those movement patterns of the bones. Another thing, like I said before, if you don't move, the joint doesn't get nutrition. I have so many people that I'm not going to name any names, but there may or may not be certain doctors out there who tell people, or may or may not be telling people, to never squat again because it will destroy your knees. What are you supposed to do? You get up and off of the couch, you go to the restroom, that is a squat. I don't want y'all to think anymore, whenever someone says squat, it means that there's a barbell on your back. Squatting is a motion. So there are ways to appropriately regress and progress, but there's still, you have to load it. And I cannot tell you how many times that someone comes in and they hurt their knee and they go to certain doctors or certain people or whatever, and they tell them that you can't squat anymore. Whenever they come to me, I ask them, so like, when did it start hurting? Oh, I went hiking for 15 miles in, whatever, in Las Vegas to the Grand Canyons. I'm like, oh, do you do that often? Nope. You're probably underprepared and overstimulated.
Well, and let's kind of play that out, right? So say that person that went hiking for 15 miles. I like to speak in word problems and like examples. So let's like play this out. So that patient, they're, say 36 years old, they went hiking with their family 15 miles, they came back with knee pain. They went to the doctor. The doctor says, wow, your knee is a mess. We did an MRI. Nothing's wrong. Can't find anything.
Or there's arthritis.
Yeah. Oh, and that's what people like to blame it on. It's arthritis.
Everyone has arthritis.
That's what they're like. Everyone. Oh, you have arthritis. So you know what? You can't squat anymore. You can't hike anymore. You can't run. You can't bike because you'll destroy your knees. Right now, let's fast forward. That patient's 36. Let's fast forward to 56. Let's fast forward to 66. Right there. Are they still pooping? Are they still getting on and off the toilet? That's a squat. So now they haven't performed a loaded squat in 30 years.
No, that's... Okay.
Do you think they are more further injury at 66 because of that advice that told them 30 years prior?
No, and I'm going to give y'all a hint on some things. A lot of certain doctors are saying stuff like that to save their own ass. Because if they tell them that they can do squats and then they injure themselves, they're going to go blame that doctor, which I totally get. I'm a doctor. I get those things. I think there's better ways to do it. But to give y'all an answer, squat for the rest of your life, and then you blow a disc because you sneezed. It wasn't. Don't it? It's because y'all haven't been squatting. It's because there weren't proper biomechanics. Loading will help change again the muscle, the joints, the bone, so that you can be preventative, making sure that bigger issues don't come about. Biomechanical issues will travel in your body, will try to balance itself until the point, and at least on my own experience, whenever it gets to the spine, it doesn't go anywhere else. And if it does, it's still on the spine. It doesn't really move anywhere else. So a few things. Pain is appropriate. Scale from 0 to 10, anywhere between like 3, like equal to 3 or less than, is pretty appropriate for working out. Now, numbness, tingling, shooting sensations, burning sensation. Well, burning, maybe not, but burning's pretty normal. But like those are things that you need to look at. Pain is okay, but as soon as you hit 4, 5, 6, and 7, that's not normal. So don't want y'all to think that like, oh man, I can't do this, that, and the other because of that. So don't, usually people like personal records, PRs, 1 rep maxes, 3 rep maxes, 5 rep, you name it, things like that, because it's numerical. If you can calculate it, you can visually see and then tell other people about it. I totally get that, completely get that. It is difficult to see performance and how your life is a sport. Don't steal that from me. I'm trademarking it. Life is a sport. You need to learn how to perform. So you need to have those goals and make sure that that's if you do have a PR, that's fine. There's no reason. There's no issues. But like you need to make sure that your PR, like if you have a PR squat is 700, 800 pounds, don't get mad at me when I can't fix your low back like that, because it takes you a long time. What have you been doing while you've been aging? What have you been doing? How have you been loading yourself and loading themselves inappropriately? People who are trying to squat 10,000 pounds probably have been loading themselves inappropriately. So those are just, you have to find that window. The best way to help yourself while you're making these goals, while you're trying to get there, while you're trying to also protect yourself, is to plan, record, and then monitor weekly, every single workout. You can put numbers up. I personally, whenever I do this, I have a little journal and I'll write down, reps, things that I'm doing, the certain amount of weights, and I will put a star next to certain weights that create pain, and then I'll write down where it was. Those are things that you need to monitor. You need to, and then once you monitor and once you record those things, you can properly plan for the future. You probably overstimulated yourself, so come down a little bit. So those are good ways as well.
Yeah. You want to take questions?
Sure. There's a.
Look back on the scroll.
Sure.
Is there more?
Yeah.
No, go ahead. You're good.
One thing I need y'all to understand is whenever we're talking, because I think this is a big disconnect whenever we're talking, because we've been training this and we've been doing a lot of research for stuff like this. If you can't hip hinge, like hip flexion, meaning that your knee is coming up towards your chest, if you can't appropriately do that, then you're going to cause your lower back to go into flexion. To put that in perspective, what you're doing is, it's like if you're squatting, instead of hip hinging, like bringing your hips up, you're doing this. That can create big issues. So it's about movement patterns, things like that. You can properly kind of protect yourself. That could be muscular, that could be joint. That's another question for. We can dive into that. We can help y'all. We love that y'all are commenting and asking us questions and wanting help. And
if you do have questions about that, if you're doing something, especially with your home workouts, everyone who's quarantined right now, and you have a question about your patterns, send us videos.
Yeah.
Please send us videos.
Sure.
Like I had so many people like just sending me stuff after the last couple of podcasts, and I love it. I will definitely give you feedback. I love getting that stuff. So please send it along if you do have a question about something specific that you're doing.
Yep. So kind of the last thing I'm going to jump into is after the age of 60, research has shown that every year after that, you lose between 1% and 2% strength, and then 3 to 4% of power every year, 60 on. Now, this may not be perfect. I don't want you, I don't want any trolls to come through and be like, well, that hasn't happened to me. Well, okay. Research has shown that that's kind of cumulative for most people. So after 60, that's kind of inevitable. So do something about it, right? So research has also shown people with better grip live longer. Why? I don't know. But how?
Nobody knows.
I don't know. People with better grip. How do you get better grip?
You grab things.
By loading. By grabbing dumbbells, by grabbing rocks, by moving, things like that. Yeah. So the biggest thing, again, kind of diving into I want y'all to remember, yes, so I'm gonna read it straight from the book so y'all know. Injury and adaptation are both the result of stress. No stress, no progress. No stress, no injury. Don't be afraid. Understand that injury can happen, but don't let that keep you on the couch. You have to load. You have to move. Don't
let that make you fearful of challenging yourself. Yeah. I have a client that I work with that's in her 50s, and she's so scared to challenge herself. She's so afraid, and it kind of breaks my heart a little bit because you have to just create challenge, and you have to push yourself, and you can't be scared. That's the biggest thing, is you can't be scared of it, because the only way to get better is to continually push those boundaries.
Appropriately, continually, yes. I think you're 100% right. Don't want people who say sleep is for the weak, in my opinion, are idiots. People who say, like, if you don't, set yourself on fire, and you don't, shoot for the moon, those are people who get injured. Those are people who start having some big issues. Load yourself appropriately. Don't think sleep is for the weak. Think earn your sleep. Don't think that if you don't have a big amount of weight on your back doing squats, that it's a big deal. I'm huge into eccentrics or negatives. Look that up on Google. I'm big into that, because you can increase the time and tension with that. So an increase of hypertrophy, an increase of power, an increase of strength, speed as well, depending on what you're doing. I love those, because you have to decrease the weight to do negatives. You have to. So it's safer at the end of the day. Teach yourself how to breathe correctly. And I don't mean look up a meditation seminar. I mean, seriously learn how to breathe correctly. That's huge. The reason why is because it has to do with the diaphragm. You've watched plenty of her videos. She talks about that all the time. It creates intra-abdominal pressure, meaning that inside here, so your lumbar spine, you can increase the pressure to stabilize your spine. If you look at weight belts that go around your abdomen, to work those correctly, it blows my mind when people don't know this. To work those correctly, you have to push your abdomen, push your belly out into the belt to create. You can't just like strap it on and like, oh, we're going to go to work. Like, you have to push your belly out into it, and that creates more stability, nice and tight whenever you're coming down on a squat or deadlift or anything like that. So I think there are ways to change variables if you want to decrease the amount of range of motion. Perfect. Do that. If you go to here on a squat or a bench press or whatever, and that gives you pain, then don't go down that far. Anyone who tells you that like it's not a real squat if you don't go to parallel, don't listen to them unless you're competing, unless you are a competitor in powerlifting, Olympic lifting, things like that, weightlifting, like things like that. You don't have to. This is functional. Life is a sport. You have to learn. You have to squat. You have to learn how to deadlift. You have to learn how to lunge, do those things, basic movement patterns.
How to push yourself up.
Yeah. My workout program, I will change the numbers in it, but I will probably never change the movement patterns that I have to do. I don't do a whole lot of periodization where I go from like, you're doing 5 sets of 5 and the next month you're doing only body weight exercises. Personally, I don't think that's important. I think month by month you should change a few things, but like functionally speaking, unless you are a professional athlete or golfer or things like that, if you just need to live life daily, protect yourself, get stronger, and look better, you can load yourself appropriately, breathe correctly, do those things, because I promise you, whenever you're 70, 80, 90, you'd squat a whole bunch of weight whenever you were younger, but like you can't pick up your kids, my guy. Like, I don't know a single person who wouldn't give up their 700-pound, 800-pound squat to pick up their kid. Ronnie Coleman. I don't know if you've seen that documentary. Watch it. But like,
you want to talk about aging?
And he's young too.
Heartbreaking.
It's not all about aging. It's just not. I don't want y'all think, because a lot of people say, I don't want y'all thinking that like, man, Ronnie Coleman went from like 20 to 60 in like 5 years. No, he didn't. He was just doing something different than you were. He was just loading. He was doing 800-pound deadlifts by 5, which is super impressive. But now this dude is on his like 6th low back surgery.
Minimum. I think it was actually more. But and it takes so much wear and tear to get to that point. So I don't want people to ever be afraid of getting to that point, because, and it's the same conversation of like women who say they're afraid to get bulky. Right? It's the same conversation.
Yeah, you don't have the hormones.
Girl, do you even know what it would take to get there? Because
you don't have steroids.
Like, please shut up.
Steroids.
And, it's the same conversation when people are afraid to load themselves, and they'll bring up Ronnie Coleman, or they'll bring up someone else. Like, I have a friend that did X, Y, Z, and now they're in this position. And it's like, well, if we're working together on this, you're not going to be in that position, and it's my job to make sure you're not in that position with proper biomechanics.
Yep.
So I don't want people to be afraid to load themselves appropriately to create changes, because that's what's going to set you up for success at age 60 or 70 or, or whatever. And, and I think the take home of this is that as much as there is an aging component to injury, that the majority of it is a biomechanical component. So you need to be more focused on your biomechanics as early as possible, literally from birth. If you are a parent, you need to be worrying about that with your children, all the way through into older age. And that's really going to be a much more powerful component than age in resulting in injury.
Just to kind of finish up and summarize, I especially my boys, my men that are out there, I don't want you to feel less like a man because you have to decrease the amount of range of motion. I'm guilty of it. I have friends who are guilty of it. I have friends who have literally texted me and said that it hurts squatting. And I asked them if they went down, I haven't tried, if they went down, instead of parallel, just above parallel. And they said, no, there's no pain. And I told them, then do that. And they literally asked me, so what's the point of doing squats if you can't go down to parallel? I don't want y'all, there should not be a stigma behind this. You are not less of a man because you don't go down to parallel. And I'll bet anyone on that. I've broken my back in 2 places. I've broken my neck. I've had my injuries before. I will do box squats for the rest of my life. And anyone wants to fight me on it and call me less of a man, let's talk. I need y'all to understand, if you are decreasing the range of motion, if you're decreasing the weight, if you're doing that to protect yourself, you're being a man. You have a future. You may want kids, you may want a family. You're doing what you have to do to make sure that you're able to be functional, be able to provide, protect your family just as much as my women out there. I don't want there to be a stigma behind it. You don't have to lift an unbelievable amount of weight. That does not make you a better man. I don't care who you are. If y'all have any questions, contact us. If you want us to look at videos, contact us. If y'all want our opinions on certain things, contact us. If you want to know where you can get treated by us, contact us. I hope that this was beneficial for y'all. I hope that y'all understand that age literally is just a number. It depends on what you were doing before and after. It's always going to be, it depends. There's a lot of variables going on, but just for y'all to understand, don't accept time as a reason. Don't accept your age as a reason to have to deal with pain. Go get help. Go ask someone if they can do something about it. I would suggest a chiropractor or a physical therapist, simply because you're able to try things prior to possible surgery. Surgery may be inevitable. I don't know. I haven't done my exam. We haven't looked at MRIs. Find someone who knows how to move. Find someone who, functionally speaking, can help you. And again, we love hearing y'all's comments. Please tell us what we should do next week.
I'm going to scroll a little bit and back up and see what we got here. So let's see. Lynn, squat essential movement. Yeah. Perception of tightness in a muscle. So why don't you touch on, Whitney wants to know a little bit about muscle tightness and how that plays into it. So do you want to talk a little bit about that? I'll keep scrolling.
Yeah. Whitney?
Whitney, yes.
Whitney. So we talked about this definitely more in depth our most recent podcast last time. I would definitely watch that because we dove into this a lot. Tightness can be a lot of times due to weakness, so there has to be strengthening involved. It depends on multiple variables, but for the most part, tightness, in my opinion, could be, and don't anyone jump down my throat, but I think tightness is a perceived tightness. I think that your muscle is probably tight because it may be holding on for dear life because it's not strong enough. So you can definitely, I don't want you thinking that I'm tight, so I don't want to strengthen it because that will make it tighter. It depends on your warm up, and it definitely depends on your cool down. Foam rolling, stretching, things like that, which we talked about last week. I think It definitely can play a role. But I want you to start thinking about like if it is tight. Stretching will help a bit, but it will plateau, and we need to start strengthening a little bit. If there's
The opposing.
Yeah, I think to make a muscle more malleable, it needs to change physically. And the best way to do that is to strengthen. So tightness is real. There's multiple variables on why it's real.
But I mean, the take home, because Whitney is, she's just a couple years younger than us. Whitney and I went to high school together. The take home in terms of this topic, the take home for that, Whitney, is that address it now, because in 5 years, in 10 years, in 20 years, you're going to be probably in the same position, if not worse. Right. So whatever the situation is for anyone personally, and Lynn had a lot of really good comments in here, not really questions, but really good comments on just the bone density conversation and the pain conversation. Lynn she's someone I used to work with. She's amazing. She's 55 and she's just a rock star in the gym. And she, is a really good expert in biomechanics too. So she had a lot of just things on that to say and to comment on. But yeah, Whitney, the take home is that you need to be worried about those things now and not necessarily putting them off and worrying about them later because of the long-term repercussions of that. And then Lynn had a lot of really good points too, because again, we harbor a lot on function here, especially in the aging topic. And while people are home, we want to see them do, out of the gym and not focusing on those PR goals. We want to see them doing a lot of body weight movements, a lot of single leg type stuff, core work, breathing work to focus on that function. And I know a lot of people are very frustrated to be out of the gym right now, but honing in on that function now is going to make you a better competitor, better set up for success when you do get back to the gym. So focusing on those movement patterns now is what's going to prevent you from injury further and prevent you from, regressing for when you get back into the gym. And we're going to check Vic's phone for comments real quick and any questions, and we'll go from there. Got anything good, babe?
Charlie said, but I should be able to throw a baby 50 yards, though. With old age, how do y'all help treat those kind of patients? Oh, that's fun. Taryn, hey, love y'all, but I do love Kels more. Don't lie, Taryn. So Charlie said, if someone has OA and RA with old age, how do y'all help treat those kinds of patients? Which that changes drastically depending on arthritis. What he's talking about is OA is your typical, like we were talking about before. OA is your typical whenever patients come in and they just accepted that there's knee pain because of old age. Osteoarthritis is very common. That just has to do with load. And again, depending on what's going on, the cartilage is worn down because of friction. For a very basic way to put it. Rheumatoid arthritis, RA, is an autoimmune disease. That will change drastically. That based on everything that we're talking about now, to put things in perspective for all of y'all, we're talking about people that don't have something pathologically going on. If there's something like autoimmune disease, if there's something like cancer or differences in collagen, stuff like that. So for rheumatoid arthritis, probably going to do FMS and SFMA on them, depending on their movement patterns, and see where they're at. Rheumatoid is big in hands and feet and stuff like that. We'll talk about dexterity. So as far as RA goes, that will probably be like another discussion.
Yeah. So Charlie, I would, if I could interject on that, I think someone that has kind of that double crush of RA and OA as they age, which is very common.
Yeah.
Unfortunately, very common. You're going to want to tackle that twofold, I would say. You're going to want to hop in on and if you're not confident in this, then find someone who is, but hop in on the nutrition side and the anti-inflammatory and make sure that their inflammation markers are in check, because that's going to be a big driver for the RA. And while you can do a lot to affect the muscles that are, contributing to the symptoms of their RA, you're never going to beat an autoimmune inflammatory response. So you
I
need
wish
to
we
address
could, but
that. Yeah, you need to address that biochemically. So
Yep.
in terms of from a biomechanical standpoint, what do you do for a patient that has OA and RA and that double crush? You don't want to really change your treatment protocol. Same thing kind of applies. You adjust the bones where they need to be adjusted.
Plan,
Treat the
record,
muscles.
monitor.
Plan, record, monitor. Get them on rehab protocols to make sure they're moving to keep fluid in the joints and nutrients in the joints. If they've also got RA, though, you've got to have another component in there.
Yeah.
Talking anti-inflammatory.
It's a great time to talk to your MDs and DOs who are watching that patient. Be very, very cautious to all my chiropractor friends that are out there. Make sure if you are giving nutritional advice, you are not trying to treat rheumatoid arthritis. That is outside of our scope. It is an autoimmune disease. It is a joint, but it is an autoimmune disease. So if you want to talk about inflammatory markers, that's kind of a different story. Just be really, really cautious on how you do that. She's absolutely right. Great time to collab with a medical doctor or DO based on who diagnosed them appropriately and who is giving them medication that they need for rheumatoid arthritis. Osteoarthritis, we definitely dove into. So I think that was early on whenever we asked that, or he asked that question. But yeah, so for rheumatoid, if you do have rheumatoid, talk to us. But so whenever we're talking about this, largely talking about people who don't have anything pathologically going on, the general population, things will change drastically depending on if there is something going on pathologically, whether it's a lipoma or if it's rheumatoid arthritis or anything in between. So yeah, I think that's. I don't
outro.
know. Did you have any more questions? I don't think I.
No, we're good.
Triple check and just make sure.
Okay.
No, I got my peeps here though, cuz.
Okay.
What up, Solar? My guy.
All right, honey, we'll come to our outro then.
I'm just making sure. I was just seeing if we had any more questions. We're getting, based on everything that we're doing every week, it's not because her and I are thinking of it, the first one, but we're getting a lot of feedback on things that you want us to talk about. We are doing a ton of research on stuff that you want us to talk about. So please ask us questions. And there is no question too small. The reason why I say that is because we are planning to have one of these episodes to be for quicker answers. We've had a question like, what's the best sleeping position? Small answers that we can dive into that'll take anywhere between 5 and 10 minutes. We're gonna kind of add on. We're gonna add on to a sheet, and then that's gonna be the entire episode as far as like smaller questions that we can answer quickly. Bigger questions as well, but I don't want y'all thinking that you have to have a very big question. Any small questions, ask us. I know Charlie's asked us. He's asked us about CBD. He's asked us about animal chiropractic, which we might get Sherry Wind in. But just ask us questions. Send us videos. If y'all need help or anything, let us know. So really, really, really appreciate y'all. We've gotten way more love than we would have ever expected on this. So we're just going to keep driving. This is a lot of fun for us. And who knows where it goes? We're just having fun right now. So
Thank you guys.
we are at the lake house. We're gonna go jump on the boat, chunk deuce. Watch our Instagram if you wanna be involved in this. But love y'all to death. Thank y'all so much for the support. To my family, to my friends. See y'all next week.
Bye.
22 viewers online. Raven was on mine. I didn't say anything though.